Hello, everyone. I'm Nick Bailey. I'm the co-founder of From Day One. And in today's webinar, we're going to be exploring a timely topic, working parents navigating the passages of parenting. To bring home this point, I'd like to introduce my co-host for today. He's the newest member of the From Day One team, and his name is Sean Bailey. Sean has been with the team for 7 weeks now, and he's really highlighted the importance of this topic for me personally. Today, he'll be co-hosting his first webinar for From Day One. From fertility planning to childcare, parents in the workplace need support to handle their multiplying responsibilities. How can employers anticipate the needs, the many stages of family life, in order to help them also fulfill their potential in the organization? Before we dive into this topic, I'd like to thank our partner, Ovia Health. I'm going to tell you a little bit more about them. Ovia Health is the leading women's and family health technology company with over 15 million members. In this webinar, we're going to explore how employers can leverage once in 100 years type of public health crisis to drive positive change and health outcomes for working parents. Now, for a few logistical items, this webinar is being recorded. It will be available on demand about 24 hours after the event. So look out for an email in about 24 hours with the link. That email will also have info on how you can get professional development credits from the session for the Society of Human Resource Management. That's SHRM or SHRM. Also, look out for a written account of the conversation soon on our website at fromday1.co. That's FROMDAYONE.co. Around 3 p.m., that's 1 hour from now for those in different time zones, we will have a Q&A session. You can submit your questions anytime using the Q&A button at the bottom of your screen. Now I'd like to introduce our moderator, the business journalist Lydia Dishman. She reports and edits for Fast Company on tech and leadership and has written for CBS Money Watch, Fortune, and the New York Times, among others. Okay, Lydia, on behalf of myself and Sean, over to you.
What a wonderful surprise. Welcome to the world, Sean. So great to see both of you on our screen. And thank you all for joining me today. I have a stellar group of panelists and a wonderful audience that I cannot see, but know you are out there, and we are very grateful that you're spending this hour and a half with us. I'm sure it's going to be packed with insights. As Nick mentioned, my reporting and editing is in the tech and leadership section, and certainly the pandemic and the twin crisis of all of the social justice protests have brought about an environment where parenting is really at an inflection point that we've never quite seen in the workforce. I also came across a new report by Clio, the Mom Project, Paid Leave for the United States and Happiest Baby. That's a lot to say. But what they found was 1 in 5 working parents said that either they or their partner are considering leaving the workforce to care for their children. And more than 50% of families are going to lose money and income by having parents or family members stay home with their children during these crises. And of course, we know that women are disproportionately more likely to be affected by this as they work at industries at risk of virus-related layoffs. Even though women make up 47% of the US labor force, they're in 51% representation in the high-risk industries. And full-time working mothers in 2-parent households are on average doing around 22 hours of childcare a week, have been doing that during this pandemic, in addition to maintaining their jobs. So there is a lot going on, and here to discuss these issues with me are, as I said, my group of stellar panelists, which I would like each of them to introduce themselves and also say briefly about your experience making the transition to remote work and how that's affected your work-life balance. Jackie, why don't we start with you?
All right. Thank you, Lydia. It's really great to be here. So happy to be talking about such an important topic. So I am the Director of People Strategy at the University of Chicago Medicine, which is a large health system on Chicago's South Side. So basically, it's like a senior HR business partner role. I partner with several of the hospital's senior leaders on a number of different strategic HR topics. And I've been in healthcare for about 3 years now. I love working in healthcare, not only because of the potential to positively impact patients and employees, but because it's such a fascinating and dynamic industry, and never has that been more true since the last 7 months. I remember back in March, our operations literally got turned upside down overnight when the Illinois Department of Public Health announced guidance that all elective procedures and surgeries should be canceled. So within 3 days, our patient volumes went from about 90% capacity to about 10% capacity. And obviously the impact on our staff was huge. We were suddenly dealing with two different employee populations. We had our on-site essential staff, our frontline workers who were taking care of our patients and, putting themselves at some level of risk as we were learning about COVID and trying to keep everyone safe. And then we also had our employees who had suddenly shifted to remote work and trying to figure out how to support our employees remotely, which is not something we had traditionally done as a company. So it certainly presented an interesting time. And particularly for working parents, we knew that they were dealing with an added level of challenge. They were trying to figure out childcare options. They were suddenly trying to get work done with kids at home and worrying about keeping their families safe and healthy. And I was one of those who was in that group. I have a 2-year-old son and was suddenly working from home. His daycare shut down, so he was home with me. So just trying to figure out how to pack as much productivity as I could into those early morning hours before my husband went to work, because he was essential. He still had to go into the office. Or, getting back online late at night after my son had gone to bed. Inevitably, there were many of those situations that are all too familiar to many of us now, where you're on Zoom calls and my son is, screaming in the background, demanding my attention. I remember one particularly challenging incident where I was on a call with about 50 people and I was getting ready to present and my son would not stop screaming. And I was just so exasperated. And I remember yelling at him, and profanity may have been involved, and then suddenly realizing I was not on mute. So clearly not my finest parenting moment. But one positive thing I can say is that these last several months have really taught me to be a more empathetic leader. So especially just knowing how much our employees are struggling and particularly our working parents right now. Thanks.
Thank you. Yeah, I'm sure everyone's got a story like that. So, bonus points for actually getting to the end of the call, I guess. Quentin, over to you.
All righty. Good afternoon. I hope that everyone is doing very well. My name is Quinton Watson. I currently work with the Salvation Army. I have over 20 years experience in human resources. I've worked in various industries, including business services, consulting services, healthcare for a number of years, and now the Salvation Army, which I'm totally enjoying. I will tell you that the Salvation Army is one of those organizations that is rather challenging because all of our services are for the people. What we do is right there in partnership when there's a disaster or there's a need for shelter services. Or people have to remember, we're church first. And the community that is established with the Salvation Army and the constituents, a lot of times are associated with the church. So for us to have to go through what we know today is a once-in-a-lifetime pandemic has been quite challenging for us, particularly because we have a very traditionalist management team. The organization is highly autocratic, but at each level is very collaborative, similar to healthcare. So from that perspective, we've had to do many things to really retain our most valued employees, especially employees who may have dealt with COVID situations. As you all know, Atlanta, Georgia was hit pretty hard with COVID. And we're one of those states where we say we work hard and we play hard, but we socialize hard. So with all that socialization comes COVID cases. So, as our organization tried to deal with these many dynamics, especially dealing with the ones that affected our employees who had parents, we had to think through how we were going to do it. So in March, for the first time, we basically started shutting down facilities, and we deemed employees essential or non-essential, and we also deemed them as telework. And as we were able to place them into that telework category, we kind of said, hey, let's see how this is working out, because we may have to revisit this over time when we open up the facilities. And of course, we did. As our non-essential personnel started to return to work, we started to reevaluate whether or not those positions were really necessary. So unfortunately, it affected families because we're church first. And I hate to say it, if it wasn't for the pandemic unemployment fund, the federal one, we don't pay unemployment insurance. A lot of our employees and families would have been left cold without any sort of income after they were laid off. So when I think about a lot of the solutions that we had to put in play was to quickly, take care of people who were displaced and reach out to those unemployment agencies and to work with them hand in hand, at least those employees who were impacted, to get through that whole process, which was months long. Finally, things started working out. And the way we were able to do it was to create a network. We had to create a network of unemployed individuals to talk through their experiences and to get them some outside help. I don't know if everyone knows, there are coaches out there that have gone through the process and they know how to help people get unemployment. We had to figure that out. And as our employees who were displaced started to get that lessened our burden. But then we had to think about what was next. COVID cases were in the building. Looked up, and we're a nice sized building here in Atlanta, Georgia. But we end up having a total of 15 cases. And so now we're talking about, putting up plexiglass in our larger departments, sending workers home so that they could be split shifted. Unfortunately or fortunately, creating split shift positions where some people were coming in the morning, some people were coming in the evenings, and some people were just doing work from home. We utilized every last single strategy you can possibly think of to help employees. Now, what became interesting is that when you had some employees whose equipment was here and they worked in what I call a specialized role, maybe a technology role, and they just couldn't work from home because that equipment was here, we all helped them load that equipment up into their cars, get it safely to their home so they could work from home. The challenge was there because some of those people unfortunately experienced COVID. One in particular, his 4-year-old daughter caught COVID while he was working home. So you just never know how all of this is going to play out. But I think the most important thing that the Army has done is really kept focused on the mission of doing the most good and doing the most good for the employees. Thank you.
Thank you. Yeah, I mean, we're all sort of feeling our way through this, one step at a time, one day at a time, right?
Absolutely.
Yeah. Gina, how about you? Introduce yourself, tell us a little bit about your work and your transition.
Hello, everyone. I'm Gina Nebesar, Chief of Product and co-founder of Ovia Health. We're very proud to serve over 15 million people navigating their reproductive health and their journeys through parenthood, and to have over 30 peer-reviewed publications demonstrating our impact on maternal and infant health outcomes, from the national cesarean epidemic to social determinants. And we've done a lot of research around the impact of COVID-19 on prenatal care delivery and parents. Personally, I have 2 little ones under the age of 5, so I'm in the same boat with many of you. They're doing virtual learning, or at least one is for preschool, which is very cute when they actually sit down and do it. But I think, like many people, I'm leaning on the support of my family. I'm also leaning on the support of my employer. We're lucky and privileged. We're a digital health solution. We didn't have to sort of pivot our operations, but what we did have to do is all work from home and be more flexible there, which we're proud to do. So early in the pandemic, we came out as office optional indefinitely to help give parents the ability to sort of think ahead, plan, and not have to worry about when they have to go back into work if they don't feel safe yet. But again, we're privileged based on our operations and business model to do so. And in general, I think we're just at work noticing people are experiencing this differently, and no two parent is experiencing this the same way.
For sure. But, like you said, even with a digital solution like you have, just figuring it all out is you just gotta figure it out. There's no recipe for this. Susan, how about you? You're still on mute.
I'm going to have a t-shirt that says that, seriously. So I will. I'm the Director of HR Operations at Beiersdorf, North America. And you don't maybe know our company, you may. Beiersdorf, we're a global branded company coming out of Hamburg. But you know our brands, probably Nivea, Aquaphor, Eucerin, and we recently acquired sun care through Coppertone, so really, really exciting. Been with the company for close to 10 years, and I do everything from, you know, the comp and benefits, total rewards, immigration, diversity, the employee experience, everything about the moments that matter as an employee. So this was a year that mattered highly to all of us. I'm a stepmom to 4 kids. So as this journey evolved, I experienced everything that our employees were experiencing with family, with parents. There were so many different touch points of things happening. And what's interesting about Beiersdorf is we have over 160 affiliates globally. So as we started to hear news through all the different affiliates, what was happening around the world, we have 2 affiliates in China. So we were hearing from frightened, colleagues in China, and very slowly we were having to put out, more and more announcements sharing, well, we're not traveling to these regions, or now these regions we're not traveling to. We have a lot of foreign nationals in our company. We have a lot of expats. So at the same time, taking care of all our United States employees, we also have our foreign nationals that are afraid. Do I need to go home? I'm single, or I want to go home to be with my family. And then all of a sudden, we have all the implications of the immigration stuff. So super, super crazy time. And I think one thing that we all have in common probably on this call is we have to be resilient. We have to learn really fast and sometimes pivot, because sometimes we learn something and then it changes. And I like to think of myself as the COVID planner in chief. Our head of our people and culture team, Louisa Stead, led the charge with us, but I was in charge of all the day-to-day, learning really fast, deciding what were the salient things that we needed to understand, to adopt. We closed pretty quickly. We had a very pragmatic, caring, agile leadership team led by Alvaro Alonso. And the team, luckily, I think made the right decision really quickly. Our core values, the first one we talk about is care, courage, simplicity, and trust. But we leaned really heavy on care. We closed early. Around the middle of March, we stayed completely virtual until July 1st. We are still virtual, but office optional. So there's the other part of the HR person's journey. I've been doing this for about 25 years, never expected something like this. But not only are you having to care for people now virtually, but you have to run really fast, learn, build a plan, share the right things, build a toolkit, communicate everything out, and make sure that people know what to do when we're virtual, how to open up safely, what does a safe office look like. And it's been an incredibly valuable journey, because there's no toolkit out there that gives you all that stuff. You really have to discern that for yourself as a culture. We had already been doing, I think, great things for our employees, great things for our parents. We had, in the last year, recently put out a parental leave pay program that allowed parents, men and women, to be out for 16 weeks of full pay. So we already were doing some cool things for parents. But I think when we went into this COVID situation and went virtual, we definitely went into overdrive. So now I'm concerned about, how do we have flexibility? We had agile work before, but now we're all virtual. So the same thing that you're all experiencing. I have kids, I have pets, and you're on your Teams calls or Zoom calls, and you have your baby, or your daughter needs help with her schoolwork. And you know what? We really approach this with a sense of curiosity, empathy, courage, definitely a sense of humor. I think I have even a story to best one of those. We were rolling out a special app project this summer, and then I heard someone flush a toilet somewhere on the phone. So you really have to lead with courage and care and culture. And the other thing is connection. So it's been quite the journey. It is really emphasized to us that the future of work will not be changing, but in a very positive way once we get past the health and safety issues. The future of work is going to be very different for us. We're going to continue to be more virtual. We're going to offer flexibility, but that means, how do we help parents? How do we find the right benefits, the right programs, and continue to live our core values?
And I definitely want to dig into all of the different things that you're saying in a little bit more detail. And I just want to make sure we go around and all introduce ourselves, but we are going to come back to some of those things that you mentioned, Susan. Rose, last but not least, tell us a little bit about your work and about your work-life balance and how that might have changed.
Great, thank you so much. My name is Rose Sheldon. I'm the Director of Enterprise Learning and Development at Allstate Insurance Company. I've been with the company for almost 18 years, most of that time in the learning and development space in different capacities, but I also was an agent for 5 years. And so I wear a lot of hats when it comes to thinking through the experiences that our employees go through. And I also have small children, so I have a kindergartner and a 4th grader. And I started to wear that hat of working mom and really trying to be vocal and help other employees through being a working parent. Soon after she was born, we were still a company where I was wearing a suit to work every day. And for women who've had to wear maternity suits to work, you know how terrible that is. And we were expected to be in the office every day until 5:30 p.m. because that's when our agencies are open till. And that wasn't a problem before I had kids, but suddenly now it's really difficult when my daycare closes at 6 p.m. and I have to be at the office till 5:30, and it's more than a 30-minute drive to get to daycare. How do I make all that work? And so I started to try to ask questions and be vocal. And the next thing I know, I often get pulled into conversations now to think through from the company, how do we help working parents? So it wasn't a surprise when on March 13th, we sent our entire employee population home. Prior to that, less than 5% of our employee population worldwide was a remote worker full-time. And we had to figure out things. Somebody was talking about, picking up computers, right? We've got 24-hour call centers, and those are all, those aren't laptop employees. Those are CPU employees, and they're down on the floor unplugging things to take home. And how do we make a 24-hour call center operate from people's homes in remote Idaho? How do we make sure that our national catastrophe team, who, by the way, has had to deal with one of the most, active hurricane seasons that we've had in a very long time this year, how do we make sure that they're able to do their job and still, be safe? And do they have the PPE they need and all of those things? So when we sent everybody home in mid-March, the knee-jerk reaction, and especially why they bring, because on top of everything, right, I'm the training lady, the knee-jerk reaction was, how do we train everybody on the software that they'll need to be a remote worker? And from moment one, I kept saying, that's the easy part. We've got to figure out, there's all these people who are going to have their kids at home, because my kids got sent home from school on the same day I got sent home from work. How am I supposed to do all of this at home? My husband and I both have high travel jobs. So I luckily, we had an au pair living with us at the time. She has since gone home because her visa expired and we couldn't renew it because of everything going on. But I took that as an additional almost like level of guilt to say, man, I have it so easy because I have somebody living in my home that's providing that extra set of hands. So I want to make sure I'm thinking about all the employees who aren't as blessed as I am with extra help around. And so we started thinking through what are the resources we can provide and what's the mindset training we need to be putting managers through to rethink that we're no longer going to be all in the office together in our suits till 5:30 p.m. and that, you're going to have to be cool with the dog barking and the baby crying in the background. And it's amazing the progress that we've made since March in all of that.
Yeah, absolutely. I think, everyone got a crash course in grace and patience during this time. You've had to be way more flexible than you could have ever imagined before. So I'm curious now, you've all given me pretty complete pictures of what the transition was like for your entire workforce. So Gina, I'm going to kick this over to you and ask you, what trends are you seeing? What have employees raised during this time about what they most need to get their jobs done?
At this point, it's no secret that the strain of the stress working parents are facing through this pandemic is putting this immense strain on not just our physical health, but our emotional health and our social health. So the first step we did was really try to understand it and what are the unique challenges that people face. So millions of people, we've been able to kind of talk to them and do perform research studies to really understand what they're facing. So Lydia, you mentioned the widening gender gap. Last month, over 1 million jobs were lost, over 800,000 were lost to women. Mental health and family well-being has also been a top priority for parents and the organizations that serve them. The most alarming trend I saw with family well-being was at the start of the pandemic when we saw relationship violence rates rise. So relationship violence, which affected 1 in 4 women in the US prior to the pandemic. At the start of the pandemic, there were these surges in police calls to police, calls to domestic violence hotlines, which you can see with the sort of the recessionary fears and the impacts of social distancing, how that affected the family dynamic, and what is that going to do not just for the parent but also the long-term well-being of the child. We've also studied the impact of COVID-19 on prenatal care delivery and our fundamental access to care. So in a research study Ovia did with March of Dimes and the Harvard School of Public Health, we actually just published this week in the Journal of Patient Experience. We saw there was a 215% increase in the interest in home births, which carry a lot more risk, which you can see with all this fear of people thinking they won't be able to bring in their family or their partner. They were sort of changing their birth plan around it. We also noticed there was 30% of prenatal care visits, 30% would be modified, change, move online, which was shocking. And this all being exacerbated, of course, for people of color. So we noticed that over 60% of Black women were saying they were receiving less frequent and lower quality care compared to about a little over 50% for I think in general, this pandemic, it's not just affecting our work environments, how we work and how we go to live. This is affecting our family dynamics and our fundamental access to care and services, which is what is the most important thing to parents is the health of our kids and our ability to be able to take care of them. I've seen employers taking action. They're certainly investing in more behavioral health resources designed for parents. They're offering virtual health support like Ovia, where we have prevention programs that have self-monitoring at home, virtual health services. And I've been pretty amazed by the investment. Everyone here on this panel has shared about what their employers have been doing, as well as our clients. The commitment that they're showing to parents at this time is remarkable.
Yeah, I do want to dig in a little bit more, now that you've discussed the trends and, there's certainly things that are very alarming, but what your individual companies are doing to meet these needs. We don't really have federal policies to really tackle all of the issues, particularly when it comes to childcare. But before we dive into that, I'm just going to invite Nick back briefly to do our station identification because we're at the 30-minute mark.
Sure. Hello, everyone. Just wanted to remind anyone that joined our webinar after the intro that we are from day one. And today we are exploring working parents navigating passages of parenting. Our sponsor today is Ovia Health. Thanks to them for helping make this possible. And as a reminder, you can submit your questions at any time, including right now. So look down at the bottom of your Zoom client. You'll see a little Q&A button. If anything comes to mind that you'd like to ask these people, please submit your questions, and we will start tackling those in about 30 minutes. Back to you, Lydia. Thanks again.
Thank you. I noticed that Sean didn't make an appearance this time, so maybe he's taking a nap. Jackie, I want to start with you. And if you could tell us, were any additional resources or new initiatives put in place since March at UChicago Medicine?
Yeah, quite a few actually. So, the themes of resilience and well-being have certainly always been top of mind in healthcare, but now it was, it was even more important. So we started support resources like our daily Zoom wellness calls, just covering topics related to wellness and resilience, that's become a recurring theme that has stayed in place since COVID. And in fact, we have Family Fridays, where once a week it's a family-related topic that we talk about. We've had an employee resource group for quite a long time for working parents, but I think, you know, some of the support services that we offered through our ERG to working parents have become even more focused since COVID. We've brought in guest speakers to talk about mental health related support, talking about, you know, educating kids at home to topics that are especially important for parents right now. And then in terms of benefits, so the number one focus was on childcare. So we had backup care benefits, but we expanded those quite a bit actually during COVID to put crisis care in place, which really was critical. Of course, important for our remote workers, but especially for our workers that had to be on site. We needed to really supplement childcare options so that, for example, they could bring someone into their home. It could be a nanny, or it could even be a relative, and then reimbursing them up to $100 a day for that. So I think those were some of the biggest benefits we saw in terms of biggest impacts in terms of our benefits. I think a couple other people have mentioned like just the need for greater flexibility, and that's been another change that, you know, we've really focused on working with leaders to look at each individual situation, evaluate requests for flexibility. If the business can accommodate it, then to try to do so. For example, if someone needs to change their shift start times based on family needs. So I think those are some of the areas in which we've supplemented what we already had in place.
Quentin, you're nodding your head. I know that you mentioned how you were doing new types of split shifts. Were there other initiatives that were implemented? You were also helping families. What else did the Salvation Army do during this time? Sorry, you're still on mute.
That's okay. I had to go off mute. I will tell you that the Salvation Army before COVID was pretty rigid with regard to, you know, our scheduling of employees' times. We have a very family-oriented style approach to employment anyway. Most of our employees work just 36.25 hours a week. They only work 7.25 hours a day with 2 15-minute breaks that they take religiously and a 45-minute lunch. And even exempt employees follow the same schedule. When I tell you that this is the first organization I've worked at that when they say 8:30 to 4:30, they mean it. They mean it. You go home. And they try their best to make sure that, you know, most of us work in 120% productivity, but my boss tells, I need for you to leave because that's just how they work. Now, we'll tell you that because of COVID, we've had to do some things differently that I think have really been more of an engagement factor for employees. Right before COVID started, me and my boss were talking about instituting a live health online behavioral health component into our benefit plan. And we hadn't done that before because we have Christian ministers here who employees can go to. They would actually pray with them when they're dealing with some difficult times and provide family support just like they would to anyone else who's using the Salvation Army services. I can tell you that after we implemented that live health online behavioral health service, and I tell you it was low participation right before COVID, but afterward, when you get the numbers back, a tremendous rise. I mean, I can't even tell you how many people began to use the service. So for us, the strategy we put in place before, which we just felt something about to happen, really paid off. And I will share with anyone that if you're not using a live health online service, definitely reach out to your benefit plan providers. We have the Anthem Blue Cross Blue Shield Network, and they've just been fantastic at coordinating this whole effort, and our employees use it.
Yeah, I do keep hearing about the rise in that. Rose, has Allstate implemented a similar service since March?
Yeah, actually, we've had a service similar through our benefits program for many years now, but similar. We've made sure to be advertising that heavily right now, and we're seeing a lot of usage, which is very understandable as I speak even to just the members of my team as they're trying to cope with just this, absolute change in the way that everyone's living. So it's been just fantastic to know that we have that resource, similar to some of the other resources that have already been mentioned. And I would say some interesting things that we've done. Again, I'm in charge of learning, and so my team, we were seeing some needs for just people wanting to self-educate on things like resilience, on ways of working from home. So we really partnered with some of our content providers like LinkedIn Learning to put together some channels that our employees could go and learn more. And we've seen just people really taking advantage of that opportunity to develop. But I think the most unique thing that we've provided, my team, we're all, I would say, recovering instructional designers. We don't do that much design work anymore, but we all have children. And we realized in the spring that, I mean, my third grader at the time was only getting about 90 minutes worth of schoolwork to keep her busy during the day. And that was very unhelpful. And I don't blame the teachers. They were not prepared for this. And I found that I was starting to create learning content to keep my kids busy. And lo and behold, when I brought it up on a team meeting one day, a bunch of my employees were doing the same. And so we started sharing that content with each other and then said, maybe we should make a page for this. And so we ended up putting all of this content that we created for ourselves out there and then just kept adding to it and saying, oh, look, I found where your kids can go on a virtual field trip. That'll keep them busy for a half an hour, right? Oh, look, you can go visit the zoo, the San Diego Zoo. That'll keep them busy for a half hour. So what resources could we put out there for employees that had reached the brink and didn't know what to do to keep their kids entertained for a while? The ones we're most proud of are the things that are also touching on social topics that have been coming up. So Allstate has decided that from here forward, Juneteenth is going to be a company holiday every year. And we made that decision quickly. And, my employees in Texas knew what Juneteenth was, but I had no idea. And so I thought, man, if I don't know, there's probably a lot of people who don't know. And I know my kids are curious why I'm not going to be working that day. Why don't we put some curriculum together? So we put together age-appropriate curriculum to explain Juneteenth. It's been our most popular curriculum we've put out there. And then the other two that have been really popular have been about the census. So why we complete census forms. We feel like we're really doing our part there. And then, of course, about voting. So we like to think we're doing our job as citizens as well to promote the census and voting, while also helping educate the kids and keep them busy for a while when they get done with their schoolwork a little bit early. So that's sort of a unique benefit that we've put out there.
Susan, my question for you is slightly different because you do have a distributed global team. What has it been like to adapt policies for a distributed workforce? Have things been different in Germany than they have been in the US?
It's been interesting. Our headquarters is in Connecticut, so we're right on the border of New York City. So New York City was a hot spot in the very beginning. Germany and we were suffering at the same time, although the US much worse so. They also had virtual time, and they've also gone optionally into the office. But I think we stayed virtual longer, and I think even when we've gone into the office, we intend to really continue allowing a more optional work. So I don't know if there was a greater desire to start going back to the German office, but I think colleagues have maybe felt a little more comfortable going into the headquarters office. I think in the U.S., just because the management of the COVID response has been kind of it's been unpredictable. We've had to be very resilient and just be flexible to that. I think what all my colleague panelists have said, we're doing very similar things. We're having to be adaptable and to address employee needs as they come up.
I know that I'm sure that Allstate is not the only company that adopted Juneteenth, for example, that, as I said initially, the crisis is sort of like a twin one with all of the civil rights issues, what I'm calling like the next wave of the civil rights movement. Quentin, you're nodding your head, so I'm guessing that the Salvation Army had done a similar thing to address that?
Well, I will tell you that the Salvation Army did something extremely special, and I will tell you that during that time, this impacted me tremendously. Being African American, living in this country my entire life, and just feeling as if the country went back for me 35 years in time, and I'm only 47, really concerned me. So I was speaking with my boss, and my role is employee relations manager. Of course, in our particular location, Metro Atlanta has a lot of diversity. And of course, I was hearing those complaints on a daily basis here at the Salvation Army, to the point where some people were immobilized to work. It was difficult, especially with what happened here in Atlanta with the Wendy's issue and Rayshard Brooks. So I will tell you that for us, it was amazing that all of a sudden our commissioner created a YouTube video. And in that video, he said, say their names. I would like for you to say Breonna Taylor. I would like for you to say Rayshard Brooks, Ahmaud Arbery, Floyd. And he just went down the whole list and sent it not just to us, but to leaders all over the country. The next week, he sent out a very interesting memo that says, we care about all of us and we care about African Americans and your history. And because of that, we've decided to close the office on Juneteenth going forward. I was in tears. I'm the employee.
I mean, that's totally moving. And, you know, the reason that I'm bringing this into this discussion about working parents is because we know that the African-American population has been disproportionately impacted by COVID. And many African-American mothers are breadwinner moms, much more so than white mothers. So, and you had also mentioned, Quentin, that there was a difference in pay practice as well?
Absolutely. So what we did, I mean, based upon your whole point, the Salvation Army has positions that are, for the most part, entry level, or positions at which people really are in them for the whole intrinsic value, definitely not for the extrinsic. So with that, there's a difference in their pay. But we do offer a very good benefit plan. Actually, it's one of the best benefit plans I've ever had the opportunity to enjoy. So when it came to looking at sick time and vacation time and actually doing the analysis to see how is this going to impact all of those employees who work in the field, we had to take a look at how much time they actually had. We had to think about how many of them would be impacted. And then we had to actually come up with an interim pay period, interim pay policy to actually help them get through COVID. And it was interesting because one moment I'm doing my day-to-day employee relations piece, and the next minute, you know, I'm suited and booted and I'm going upstairs and talking with the commissioners about a policy for interim pay. And this is going to impact over 10,000 employees in the Southern Territory if unfortunately they were impacted by COVID. We had to negotiate that policy. Salvation Army is not this, how can I put it, Fortune 500 organization with lots of resources.
Yeah,
but we
it's a
were able
nonprofit.
to negotiate at least 10 days of pay. And that went for anyone who was impacted by a COVID-related situation. That was a COVID-related situation for daycare, for quarantining, just for dealing with the mental stress around dealing with COVID, because some people just couldn't handle it. And they got an opportunity to use that time if they can validate the time was necessary. And not necessarily looking back at documentation for actually getting COVID. We gave you that time because we didn't want you to be here if you had the COVID. We were trying our best to reduce community spread, because in our organization, the work we do, if we have something like that happen in a shelter, you got community spread.
Yeah, so, for sure.
Yeah, it was all about managing the risk, but at the same time, doing the right thing for the employees. And our employees appreciated it. We look back at the amount of time that we've actually given to employees. It'll definitely impact next year's raise. So we probably won't have raises for a couple of years, but it's better for us to do this and really get through this whole situation, retain our employees, and at the end of the day, get that return on investments, because employees are definitely going to more so be engaged by how you treat them.
Well, and you just kind of gave me a lovely little segue into my next question, which is, I want to know how each of your organizations are measuring engagement and health and well-being, because I know that with these changes in policies, people can't help but feel like somebody's looking out for them. And that in turn boosts gratitude and recognition and engagement. So Gina, I'm gonna start with you. Tell me what you're seeing and what methods are being used to measure well-being.
Within our own organization at Ovia, we have a couple of different tools that we're using to measure the well-being of our teams through anonymous surveys and feedback. And much of our efforts is channeling towards how do we help people on our Ovia's platform, detect their risk for depression or perinatal mood disorders amidst the pandemic. So on Ovia's platform, for example, we're delivering digital depression tools and screeners at 3 times the rate that's delivered in a clinical setting. So for example, those who've had a baby remember the EPDS or the Edinburgh screener they took at their 6-week postpartum visit. We're delivering that actually as early as when someone's trying to get pregnant, multiple times through their pregnancy, and then several times postpartum in the baby's first year. And then based on their assessment, we'll navigate them to the company's mental health resources. I think, Rose, you mentioned we already have a lot of these resources and now they're surfacing amid the pandemic. So navigating people to their EAPs, their behavioral health programs. We provide behavioral health coaching, and also, navigation to community programs are mostly virtual at this time, navigating people to virtual resources as well. And the support that we're providing, one thing we've noticed is that the coaching volume that we've delivered, I think we've doubled the coaching volume since the start of the year for reproductive and emotional health and relationship health concerns people have had. And that every single question that comes in to our coaching team is layered with anxiety. So people are asking, not only how do I breastfeed or how to, help me prepare to deliver. It's now, how do I breastfeed if I have COVID? Or, what if I have to go home after delivery 24 hours after I give birth, which, I think, a quarter of people are being told. So every single question has this sort of mental health element to it.
Yeah, I mean, I can't even tell you how many surveys I've seen come across my desk recently about the level of anxiety just being unprecedented during this time. And it's natural because as much as people love to plan, you can't plan for something that you have absolutely no idea how this is all going to unfold. But Jackie, you were nodding vigorously when you heard the word anxiety. So I'm going to toss it over to you and tell us how you're measuring health and well-being and engagement.
So we always do an annual employee engagement survey, and that's supplemented with other surveys as well, like burnout survey for physicians and other clinicians. But what we're finding this year is that there's much more of a need for more real-time data than what we're going to see through an annual survey. So we've been trying to get creative about how do we supplement that. So for example, sending out micro surveys to get the pulse of our employees, and also through more qualitative measures like focus groups with employees. We've started to put an increased focus on what we call stay interviews, and especially if there are certain populations where we know stress levels are particularly high, or we've seen indicators like an increase in turnover. We've also been looking at metrics, for example, like our employee assistance program and the usage of that service. We know that since March for this year, we've seen an increase of about 30% in EAP usage versus the same time period in 2019. And we were looking at some of the trends around what kinds of support are employees looking for. Not surprisingly, anxiety and depression were quite high on the list, and also an increase in requests for legal services. So, we've been looking at a number of different non-traditional metrics to try to supplement what we would typically look at and get more of a real-time view.
Susan, is there some sort of way to measure there that you've
Yes.
implemented?
We did something similar. We run an engagement survey every year. We used to use Gallup. Now we're using a program called Glint, and it gives you a lot of really rich information. We actually did this before the pandemic hit. So there were a lot of topics around, women wanting to be more empowered, people feeling happy at work, maybe not feeling great about how their career developed. So we had already been working on some of those aspects before the pandemic hit. But since then, we've run a future of work survey and really gotten a lot of rich data about how people feel coming back to work, how they're feeling, feelings of stress, having to balance, having children and trying to work. How do they be on Teams calls and make sure that they get their work done? Is my manager caring when I do my work? How do I navigate a weird conversation about that? We have LinkedIn Learning, which we're super happy to have, so employees can use that anytime, selfishly for themselves too, for their kids. But I think it's definitely a lot to navigate. We actually accelerated adding a new EAP. I don't know about my colleagues, but we had an EAP that wasn't so stellar. We found a really great EAP. So the 24/7 conversations, the great website. We've been running focus groups. We have a managers program called the Managers Acceleration Program MAPS that we run monthly in a learning and development program where we talk about how to lead with empathy, how to engage with your employee. And what's really super interesting to me, also, I have a team of my own. I thought I was connected with my team when I was coming to work every day, working from 8:30 to 5:30. And this idea of connection has taken on a whole new meaning. This idea of taking care of people is more of a holistic way than I've ever looked at employees before. And I feel like I'm a caring person. I think this situation has opened all our eyes about I need to take care of everything about how you work, you live, you think, the emotions that you have, the concerns that you have. So it's not just about having a great benefits package anymore. It is really brought in the whole idea of holistic employee health and wellness. So I'm glad I'm even in a tough moment, it's really opened my eyes up as a person and as an HR practitioner.
I think that's sort of a familiar refrain these days that, you thought you were on it and then everything changed, and connection, even just asking, how are you, has taken on a whole new meaning. Rose, you're also nodding vigorously now. How are you all measuring engagement and well-being?
Very similar to what people have said. I think we're really cognizant of survey fatigue, that right now, actually just even before I logged into this, I did some Carnegie Mellon survey that popped up on my Facebook, that took 10 minutes. So I think that we're all being inundated because everyone's trying to figure out in your personal and professional life, like, how are things going and are you getting exposed and all of those things. So we're trying to limit the number of surveys. We did a similar future of work survey to kind of get our arms wrapped around how people are feeling in terms of, do they want to go back to an office? But some of the interesting ones are looking at usage rates, not only of the employee assistance programs and the wellness programs that we have, but what are the upticks in usage and participation in something like our employee resource groups, and the other, like, learning resources and things that we have out there. What are we seeing as we even transform in the talent acquisition space when we're removing locations from our job postings because we've realized it doesn't really matter anymore. You can work from anywhere and do this job. So it's been interesting. It's these longer term behavioral changes that I'm very interested in, and working with our people analytics team to figure out what are the long-term effects of this, not only to parents, but just our workers, and how they're utilizing what's been there for a while, but utilizing it in a different way.
I want to bring this particularly back to working parents because that's why we're all here. And I keep seeing a lot of surveys as well saying how that people are working longer hours and their productivity has skyrocketed because obviously you don't have some of the factors that you would if you were commuting and, getting distracted. Yes, Zoom fatigue is real. I'm not saying that it isn't, but you're less likely to have to be navigating between different things. So I'm wondering if at your organizations, if working parents have chimed in and said, yes, I'm more productive, but, and what those buts are. So Gina, let's start with you on this one.
I'm not sure I've heard the same feedback of being more productive at home. I'm with Jackie. I have the interruptions of the kids all day long, but I have found it to be very supportive. So we have a very transparent work culture. I lead product and engineering, so it's agile development. Everyone sees your workload every week, but we've been making a lot of accommodations for each other. I don't have childcare from 1 to 3. Can we reschedule this meeting? So if anything, I've noticed just this, more of a team camaraderie. We're all in it to help each other out, and a great amount of empathy. Maybe flat productivity. I'd like to hear from these people that are now working. The productivity has increased with their little ones at home.
I think it varies on a case-by-case basis, but I think that, and I'd like to get to this, maybe a little bit later on, but, just the sort of notion of it being a great equalizer. But Jackie, you said that you were juggling as well, but what have you heard from some of your colleagues? Are they increasing productivity, decreasing productivity?
Well, I think like you said, it really varies on a case-by-case basis. I think we're still learning exactly how different people are impacted. It makes sense what the research shows, that generally when you work remotely, you can be more productive. You don't have that commute. And I imagine that's true for the large majority of our employees. I think our concern has more been around that work-life balance. Just because you can work more hours doesn't mean you should. And it's becoming more important now. We're realizing more and more that for our remote employees especially, how do we help them maintain that work-life balance? How do we set the right example as leaders? And how do we equip our leaders really to lead remote teams more effectively? So that's been part of our focus. Not only in working with the leaders to make sure they're more equipped to lead remote teams, but really focusing on setting those, encouraging employees to really set those boundaries. For example, we encourage VPs and other senior leaders not to send emails at midnight where your employees might expect they ought to respond right away. To really have team norms around when are you expected to be available by phone or by text, and when should you just disconnect completely. And if there's really an emergency, then okay, we'll get a hold of you through a designated means. But really encouraging employees to draw those lines in the sand so that they don't start to suffer greater degrees of burnout. One other thing, actually, that I was going to share, even for some of our employees who are working on site, a lot of our leaders, especially, they either are fully on site or they rotate between at home and on site. And I remember one town hall session where we were getting a lot of feedback from those leaders, like what are the biggest stressors for them. And we really expected them to say, just being on site, trying to help our staff deal with the fears of potential COVID exposure. And yes, those were important concerns, but they said really the biggest stressors have been trying to juggle work and home life. And just like everybody else, trying to take care of your kids, figure out childcare needs, and I think the large majority of our employees, certainly those who are working parents, really that continues to be the biggest challenge area. So continuing to focus on that.
Yeah, for sure. We're going to take a brief break. I'm going to invite Nick and potentially the newest addition to the From Day One family back on to do our station identification.
Thank you so much. It's just me. Unfortunately, Sean hasn't been the best employee. He does do a lot of sleeping on the job so far, so we have to limit his involvement. Anyways, thanks to all of you who are participating in Working Parents Navigating the Passages of Parenting. And thanks to our sponsor, Ovia Health. At this time, we're going to take questions from you, our audience. We have quite a few down there, and there's plenty of room for more. So click the Q&A button at the bottom of the screen. Thanks so much.
Great, thank you. Yeah, we do have some questions coming in. I would encourage everyone to continue to send in, and we'll get to as many as possible. But I do kind of want to make sure that we get to Rose and Susan about this issue of productivity and measuring productivity, or even informally discussing productivity. Susan, you mentioned having to become a more empathetic leader. Are you changing the notion of productivity because of that?
I think we are. I think there can't be a set view of what productive looks like. So productive isn't necessarily working 9 to 5 without a break. It might be, it might be compressing your week. It might mean working in the evening because those hours help that employee balance their workload. And sometimes when I have managers that are trying to navigate having those conversations with employees, I ask them to show that empathy and ask those questions. How can I help you? You're trying to meet this goal. We have this deadline. Let's figure out how we can work through this together. And I think it just helping to turn on that light bulb that, have a conversation with your employee. Don't just assume that, they're going to get it done a certain way, and don't think about not caring about that. I just think, I think employees sometimes don't know how to ask those tough questions. Like, I don't think I can do this today. So open up the door. How can I help you? What's the barrier? How can I make things easier? What are you getting stuck with? What are you worried about? What's making you anxious right now? So I think with our MAPS program, with the work our whole people and culture team does across all our functions, we just want to make sure that we remove barriers for employees and managers just communicating. And we have these focus groups, we do these pulse surveys, but we really just make sure that we keep communication open. And that also includes letting management know, what are things that we need for you to emphasize. For instance, people aren't taking their paid time off. We have unlimited PTO, no minimum, no maximum, but people aren't taking time off and they're feeling stressed. And there's a lot of articles floating out there around burnout. So I think we're all concerned about making sure people use their benefits. I even was talking to a team member this week. You figure out when you want to take time off, and I'll work with you to help you cover it. Don't worry. So we want people to take care, and managers are here to help, and so is HR.
Yeah, I'm one of those people that just wrote about burnout. So I was elbow deep in that issue, and I see it particularly for working parents because there is this dual role that they are playing teacher and they're also trying to get their jobs done, not to mention maintaining their relationships with their significant other, their partner, and for members of the sandwich generation, maybe doing elder care as well. So the risk of burnout is very, very real. And I have seen that employers are looking at productivity very differently. Rose, I did want to get to you on this because I'd like to hear what Allstate had to say about that.
Yeah, and I'm very passionate on this topic. I think that when we all got sent home, there was this best practice that came about that said every day you need to schedule like a happy hour with your team, and make sure you're checking in and that they're visibly seeing you. And I've been leading a remote team for several years now, and I'm like, that's a terrible idea. Like, why would you want to slam this extra meeting onto their day and like this forced social time, when most of my employees are parents and they would probably rather have that extra half hour to either go start dinner or, help with homework or maybe sneak out another 30 minutes of work on a project. And so we found the very beginning was this increase in busyness. And I hate busyness. I hate meetings for the sake of meetings. It just stifles creativity and innovation. And so we've had to kind of do this, reeling back campaign of, okay, you don't need to actually fill your day with meetings, because if you're in meetings all day, then there's no time to do your real work. The second piece of advice I've really given to people is focus on the work and not the hours. And again, I lead a creative team, so that's easy to do. And, creative people tend to have weird hours that they work. They get these bursts of energy at 2 o'clock in the morning. You wake up in the middle of the night and you finally realize what you've been trying to create all along, and you go and do it. And so if you are in a position where you're leading teams, and what we've been professing to our leaders, if you're in a position where you can just focus on the work that needs to be done, and as long as that employee is getting the work done, who cares what hour of the day they're doing it in? Or maybe they are going to be super productive. I know that when I'm under stress, I work faster and better. So I can knock out a project way faster under stress because I know I've got to get this done before it's time to go to soccer practice, than if I was trying to put that into this perfect box of 9 to 5. And then the final piece that we've been trying to promote is the idea of showing yourself being real at home. So I know on LinkedIn, I do a lot of posts showing things like, I had to give up baking years ago because I just didn't have time for it, for work and kids stuff and family and everything else. And so I stopped baking even though I loved it because it was becoming more of a stress than it was a pleasure. And this time back, I've got, 2 hours plus of my day not spent in a car commuting right now. In the middle of the day, I get to go downstairs and have lunch with my kids, which I never get to do. My husband and I walk to the bus stop. Our kids are in school for the mornings right now. We've been doing the bus stop walk together because we never have been to the bus stop with them before. So it's taking advantage and having that growth mindset and then sharing it with the teams and letting them know, look, I'm a leader and I'm taking time out of my day to bake a cake or have lunch or do these things. I'm not expecting myself to work nonstop, and I'm not expecting you to work nonstop either.
Absolutely. And I do think there are silver linings for a lot of working parents in this where, many have told me, especially, or the higher level managers and executive C-suite level, like, oh, gee, I get to be home with my family every night. And isn't that wonderful? Let's try to knock out a few more questions from our audience. Anna wants to know, many companies are offering parental leave for moms and dads. Where do you think the market is going in this area from a private and public point of view? And I had mentioned earlier that we really don't have a federally mandated parental leave. We're one of the few countries that doesn't offer that. So what say you? Who wants to take this one first?
So, Susan, I'll weigh in. You know what? We don't have a federally mandated program. We have different state programs, and maybe because of the nature of our business, we're in a lot of different states in the U.S. And we really found that that employees weren't taking the time that they needed to care for themselves, to care for their children, and to have that bonding time. And then on top of that, I think we realized there might be a stigma that dads felt about not feeling that there's something out there paid for them. There was FMLA to protect jobs, but not something that if they wanted to split it, or maybe they're a single dad, that we fully and equally provide a caring benefit for parents. So, I hope something, in the government sector starts to provide more support. But I think this is really the trend. I think many other companies may be following that parents need time to care for their children, men and women, and we need to be supportive.
Anyone else want to add something?
Yeah, I'll jump in quickly. So it's been a pretty unique perspective on this from the healthcare industry. So I actually came from the technology industry, and I was pregnant at the time I left my last job, and I walked away from 20 weeks of paid parental leave to join a company that didn't offer paid parental leave. And at first I took the job for other reasons as well, but that I was just like, how can this be? And I have come to find out it's actually, that's the norm in the healthcare industry right now. Fewer than 20% of healthcare companies offer fully paid parental leave. A lot of them offer short-term disability like we do, which, pays a portion of your salary, but that doesn't extend to the non-birthing parent. So it's actually one of the things that we were planning to implement right before COVID hit, and then with the financial impacts, it's been put on hold. But I think there's a realization that, we need to try to advocate for our industry, healthcare, to try to, get with the times, because it's harder to make the case, from a financial perspective, knowing how much it's going to cost for that parental leave when the majority of our competitors don't offer it. So a bit of a different perspective in healthcare.
Yeah, for sure. And, you know, it's, I think it's a delicate balance. Like, where does the employer's responsibility override what, you know, what our government is providing or not providing us? Um, Janine wants to know if she's having difficulty finding resources for parents to share with them. I'm finding the need for tutoring, nanny help, consultation for depression. Where can I find resources to share? I think this might be variable state to state, but you all tell me if you found any sort of one particular place to share parental resources with. Does anybody know?
One good place is employee assistance programs if you have one. I think the states are good resources. You know what? There's so much information out there. There's parent groups, there's parent magazines, there's parent blogs. Just if you think about all the ways that you find great parenting help, you're going to find a lot of COVID supporting parent type of material. Just my suggestion.
And this is Gina. Potentially we could follow up after on these resources, but Ovia offers a lot of resources for parents that we create in-house, all under supervision of our chief medical officer. It's trusted. It's not just, you know, openly searching the web about COVID-19 and safety for children. So if we follow up, I'd love to share some of our resources that you can provide to your employees.
I'll chime in too, because also in the question, sort of kind of leading into this as well, it was asking about resources to, you know, kind of keep your kids active and engaged in something online. Although we haven't pulled the trigger on any of it, I've found that when you reach out to these companies, most of them, so like somebody mentioned like ABC Mouse and things like that, if you reach out, most of them are willing to strike a deal to like do 1 year access, like you buy in bulk, and then you can advertise that to your employees, and the people who take it, like you've paid a year subscription, and they'll do that for you in smaller amounts. So we've definitely looked into that. And then the same thing with the large tutoring companies. So if you reach out to like a Huntington or a Kumon or something like that, because they also, especially the tutoring services, so much of that is in person normally. And at least in Illinois, you know, that's really tough for them to be reopening right now. So in your tough states where things aren't opening up, they're looking to get creative and figure out how can you do that. So I would encourage you to reach out directly to a lot of those resources and see what they're willing to work out, because they're trying to keep their doors open right now and they're willing to strike deals.
And this is Quentin. I think it's also a great time for companies who have what I call employee focus groups to start utilizing a network there. Having an opportunity to talk through their challenges, even remotely, not to say they need to get together in meetings, but to begin a SharePoint site, a central repository site that is relevant to the times today will be very, very good. I've used those groups in the past, even for just engagement issues, where we've noticed some departments have those levels of engagement. And when you add that focus group, I'm going to say that objective group of people who share similar experiences, I've typically known that some of the solutions they come back with have been very helpful, especially for issues that impact people's lives. So that may be a way to go.
Thank you. That you actually all answered 2 questions with that one. So that was helpful. We have another one that, anonymous, asking, our company has looked at providing additional support such as subsidized childcare. However, we're finding that companies such as Care.com and LifeCare do not have a lot of coverage within some of our larger employee population areas. What would you suggest to help support these employees that need help with childcare, either emergency or long-term?
So that was part of what we looked at. How could we come up with additional childcare benefits that would be flexible enough to work for a number of different situations? And so we went a number of different avenues. We provided premium membership to Sitter City, you know, if just to have available resources, but especially not only for cases where it might be some of our employees live in more rural areas, and some of them weren't necessarily looking for that kind of a childcare arrangement. They were looking for something more unique. So we implemented a flexible backup care, so they can send their child to one of our backup care centers, and that's subsidized. I think it's like $15 a day per child. Or they can arrange to bring a child care provider into their home for a low rate of like $3 an hour. So it was really looking at like 4 or 5 different solutions that would meet the different needs of employees, because, you know, I think one of the recurring themes here is that it's not a one-size-fits-all solution.
And if I can piggyback on that, we have just a particular subset of employees that qualify for our backup care right now. It's something we're sort of testing, but we work with Bright Horizons, and similar, like you can use their centers, you can do things. But one of the things I thought was interesting is they also provide, like if you have special needs children that you need a particular type of care for, aging, adults or ill adults that are in your house that need assistance, and then even pet care, which I found, fascinating, but very important right now for a lot of our employees who are going back into the office, and like their dog care place isn't open. So what are they supposed to do? But I know that one of the hardest things to convince our executives to want to invest in that backup care package is it's expensive. It's expensive to go in. And they told us, they're like, you'll have less than 3% of your employees that will actually partake in this. So it's funny, and it's living into that. I'm curious, now you guys made faces, it's sort of living into that in this test population. But it's one of those benefits that we're realizing it's good to have, and the people who need it. But most people are just thankful to know it's there, even if they never use it.
That's important. We have another question that I love and was going to ask myself if we had time. So thank you, Deidre. How do you train managers how to work with employees, considering how unique each individual's situation can be? And so I definitely wanted to get to the training portion of this, especially for working parents. So who would like to begin with this one?
Well, I can share that at the Salvation Army, the majority of our leaders are from a ministerial capacity, okay? So my role, employee relations and training and development, is to sit down with them and to talk to them about some of the things that you can talk through from that employment standpoint, and take off your ministerial hat for several reasons, managing the risk as well. So with that being said, they've had a great journey, because I encourage all of them to do not monthly one-on-ones, but weekly or intercept one-on-ones. When you see it, talk to them, pull them aside. There were so many people who were going through emotional challenges. They were just breaking down or heading out the building. It was like, what's going on? We got to go grab that employee. But leaders had to take off certain hats and become very, how can I say it? Encouraging, but not so encouraging to the point where they cross the line. I just work in one of those organizations that they can almost hug you through it. So the solutions that they had to actually think through would be the ones that would actually center the employee back to a place of productivity. So our challenge is a little unique because, if our ministers had given them the world, they would, right? They just would. But we've also learned that their respect for the employees and respect for our leaders actually has been growing tremendously. Employee relations, we do conflict. Just because of those intercept moments and those one-on-ones, I'm starting to see conflicts go down. I'm not in their departments dealing with these heavy issues. People are more, how can I put it, encouraging of each other and accepting of each other. Additionally, what we did may be something proactive, but every time a new employee comes in the building, we have them do their Myers-Briggs profile, and we tell them to give it to their manager and have a long conversation about their needs. And that has been really helpful, because at the front end, what they're not afraid to share in that interview, I'm actually finding out as soon as they start, and we can put those solutions in place quickly to retain them.
Anyone else want to add?
I would love to chime in. I have to implore that the most important things that managers are being trained on right now is having a growth mindset and leading with high trust. That you can't lead a remote team. You can't lead all these virtual workers with, unusual situations if you're not trusting that they're doing the best that they can every day, that everybody is doing their very best. And so we've been doing a lot of work on building high trust leadership amongst our managers. And then the other piece is having a growth mindset, that if you are so stuck on when is this going to end so we can get back to doing things the way we've always done them, we're not going back. We knew that 2 weeks into this. We're never going back to what it was. And so, we have done a ton of training. I've sent, I don't even know how many books to managers, the book Mindset by Dr. Carol Dweck. It's fantastic. Just go watch the 15-minute TED Talk. If nothing else, if you've got somebody with a short attention span, it's just so important. So those are my 2 things. If you're going to train your managers on anything, growth mindset, high trust leadership.
Yeah, that's I love Carol Dweck's thing, so I second that recommendation for real. We have another one that's asking about what do you do to get buy-in from leadership that doesn't believe that these are extraordinary times, and I think that's a really valid question too, particularly when it comes to handling working.
That's hard to believe that leaders would think these are not extraordinary times. I'll let others weigh in because I haven't encountered that exact challenge, but I'll just comment that we've certainly been struggling with getting buy-in for, wanting to prioritize certain additional benefits, for example, that we know were going to cost money. And, as you probably know, that the healthcare industry was hit incredibly hard financially, along with many other industries. So, in terms of, our financial ability to support additional costs, it was limited. But really, I think you've got to have the data when you make your business case. It's got to be data driven, but especially in recent times, it's equally important, I think, to supplement that with very compelling anecdotal data. I mean, we reached out to employees and focused on getting their stories. Like, what are really the challenges that you're facing? And I think including some quotes and some of those personal stories when we were working with our senior executives around what's most important, that was really helpful for them to get more of a sense of what is it that employees really need.
Yeah, there's a similar question about managing stakeholders that aren't willing to adjust expectations to the realities of the current environment. And I would say that Jackie's response about getting anecdotal evidence in addition to data would take care of that. Do you all agree? Does someone else have anything to add?
You know what, the other thing I would add is when I've encountered a manager that felt like, well, why isn't this person, they're not on when I need them to be on, or they don't seem engaged. Ask your employees some powerful questions. Get curious. Have compassion and get curious and ask. It seemed like it was a tough time for you to be on the call. What was going on? What are you finding? Get the person to open up. And I think compassion is a really important element of this, but also vulnerability. Get vulnerable yourself. I have dogs barking. My husband's trying to vacuum and do things, and I'm on a conference call. It's like, just get vulnerable, be real with them. It's like, being a leader doesn't mean that you have a cape and a superhero shirt or anything. We all have to get out of bed and balance the same stuff. So get in it with them. It's messy. Life is messy. It's even messier right now. And just being in it with employees and telling them I'm struggling too, or I'm feeling kind of lonely today, or I didn't get to see my mom this summer. I mean, just get real with them. I mean, that's what I encourage my managers to do. And that's what I've done with my people. Just, if I'm having a down day, I'm like, I'm having a down day, but we're in it together.
Amen.
And if it's your executives that are having a hard time, I mean, working for a big company where the distance between them and a frontline employee is so far. We haven't had too much trouble with this topic, but with other ones when it feels like they're very disconnected from that frontline employee, using some human-centered design, building an empathy map and putting a face with real data and making them look at that slide and imagine that person that they're saying, no, this doesn't matter to, really does help. So it doesn't have to be a real employee story. It can be, aggregate data about particular employee areas, and assigning a picture to it that fits that can be very, very powerful.
I think we have time for one more, because I want as many people to weigh in on this one as possible. It's saying for many Fortune 500 companies, but I think this is really for many companies just in general, regardless of size. Cost pressures are significant. How were you able to convince your employer to fund these incremental resources when they are discussing things such as layoffs and G&A savings at the same time? Anything to add to the business case is greatly appreciated, i.e. talent retention statistics. Who would like to start with this one?
Well, I can. One of the things that I said always about being an employee relations manager is that it's my responsibility to teach my leaders how to understand the engagement levels of their employees, okay? Your fully engaged employees can, in the same job classification as somebody who may be disengaged, can actually take on much more work because they're not afraid of it. They're so engaged that they want it. And it's during these times where you're challenged financially that you have to think about those out-of-the-box solutions and determine who's on your team and who's not. And don't be afraid to have those courageous conversations when you're talking about that budget. There's a lot of things going on right now. It's tough. But most importantly, we've got an operation that we got to support. And we would not be doing our job as good HR leaders if we don't have those conversations. So that would be my advice.
Gina, you were about to say something as well?
Yes, I would say looking beyond the talent and productivity and retention stats, looking closer at the healthcare impact is also helpful. So for example, thinking of even just one case of undetected perinatal mood disorder could cost $38,000. And when, prenatal visits are being canceled, adherence to that postpartum checkup visit might go down because I can't bring my baby with me to go to that appointment, so I'm not going to go this time. I think there's a lot of data out there to suggest that all of these changes in care delivery are going to impact mental health outcomes, family wealth outcomes, as well as these other high cost condition areas, such as prenatal health.
So I'll add a couple things. Lydia, earlier in the discussion, you had mentioned some of the statistics around parents who are thinking about leaving the workforce for childcare responsibilities or other reasons with, just everything they're juggling right now. I think those can be really compelling data points. Our organization participated in McKinsey Women in the Workplace study, and their report just came out, and they actually put it at 25% of women are thinking of leaving the workforce. So having statistics like that, I think, to help make the case for, let's retain our talent can be very powerful. Oh shoot, what else was I going to say? Okay, well, I had one other point, but it slipped my mind, so I'll come back to that.
And if you're trying to make the business case, so maybe I'll say this because I've only been in human resources for 2 years. I've always been out in the business. I've found that I partner with a lot of my human resources colleagues to make these cases, to really set them up the way that, the people in sales or marketing would actually put that business case together. I've found that, there's just a different way that we ask for money in human resources than other parts of the business do. I've found taking almost like a scientific approach to it, stating the current state and the problem statement and building a hypothesis statement and really putting it all out there really does help. So if you're not quite sure, if you feel like you're not getting the point across to your execs, reach out to areas of the business that have, for some reason, it seems like all of their projects get approved, all the funding they need gets approved. How are they asking for it in a way that's different than the way you're asking for it?
Oh, I'm sorry, go ahead.
External. Sorry, I remembered my other point. So external data points are really powerful too. So we've been relying more than ever on like collaboratives that we're members of. So working with our peers at other institutions, because if we can show that, you know, peer institutions are doing this, it provides a much more compelling business case for why we should be doing it too.
Well, I'm sure we could talk about this for another hour and a half, but we do sadly have to wrap it up. And I would encourage everyone who did not get their questions answered, please reach out to each and every one of us on LinkedIn. Feel free to ask those questions directly. I know some of you had specific questions for specific panelists, and the best forum to do that is one-on-one so that everyone gets those needs met. And with that, thank you all for spending the time with me, and I will turn it over to Nick.
Thank you so much, Lydia. Thanks to all the wonderful speakers today. That was a fantastic conversation, and especially thanks to Ovia Health, and thanks to you for participating with us today. If you'd like to join us for more virtual events, you can head to our website, fromday1.co. That's FROMDAYONE.co. Check out more of our upcoming webinars, and then also our full-scale virtual conferences. Our next one is this coming Tuesday on October 20th. That'll be our third full-scale virtual conference. It'll have panel discussions, workshops, and networking. This focus is on the workforce of the future. So new insights on recruiting, engagement, career development. You can visit that website, fromday1.co, to learn more. Next week, also on Thursday, we have another webinar on the 22nd of the new recruiting, how companies are adapting for 2021. And we have an extensive schedule. We're producing almost 100 pieces of content per year now, including webinars, virtual conferences. All of that is on our website. Check it out whenever you get a chance. And in the meantime, thanks everyone, and stay well. Cheers.